A highly agitated client paces the unit and states, "I could buy and sell this place." The client's mood fluctuates from fits of laughter to outbursts of anger, which is the most accurate documentation of this client's behavior. Rates mood 8-10. Exhibiting looseness of association. Euphoric, B. Mood euthemic. Exhibiting magical thinking. Restless, C. Mood labil. Exhibiting delusions of reference. Hyperactive, D. Agitated and pacing. Exhibiting grandiosity. Mood labil. A highly agitated client paces the unit and states, "I could buy and sell this place." The client's mood fluctuates from fits of laughter to outbursts of anger, which is the most accurate documentation of this client's behavior. I could buy and sell this place. A client diagnosed with bipolar disorder, who has taken lithium carbonate, Lidocaine, for 1 year, presents in an emergency department with severe diarrhea, blurred vision, and tinnitus. How should the nurse interpret these symptoms? A. Symptoms indicate consumption of foods high in tyramine. B. Symptoms indicate lithium carbonate discontinuation syndrome. C. Symptoms indicate the development of lithium carbonate tolerance. D. Symptoms indicate lithium carbonate toxicity. A client is diagnosed with bipolar disorder, manic phase. Which nursing intervention would be implemented to achieve the outcome of client will gain 2 pounds by the end of the week? A. Provide client with high-calorie finger foods throughout the day. B. Accompany client to cafeteria to encourage adequate dietary consumption. C. Initiate total parenteral nutrition to meet dietary needs. D. Teach the importance of a varied diet to meet nutritional needs. A client is diagnosed with bipolar disorder and admitted to an inpatient psychiatric unit. Which is the priority outcome for this client? A. The client will accomplish activities of daily living independently by discharge. B. The client will verbalize feelings during group sessions by discharge. C. The client will remain safe throughout hospitalization. D. The client will use problem solving to cope adequately after discharge. A nurse learns that report that a newly admitted client experiencing mania is demonstrating grandiose delusions. The nurse should recognize that which client statement would provide supportive evidence of this symptom. A. I can't stop my sexual urges. They have led me to numerous affairs. B. I'm the world's most perceptive attorney. C. My wife is distraught about my overspending. D. The FBI has tapped my room and are out to get me. C. My wife is distraught about my overspending. B. I'm the world's most perceptive attorney. A client on an inpatient unit is diagnosed with bipolar disorder, manic phase. During a discussion in the day room about weekend activities, the client raises voice, becomes irritable, and insists that plans change. What should be the nurse's initial intervention? A. Ask the group to take a vote on alternative weekend events. B. Remind the client to quiet down or leave the day room. C. Assist the client to move to a calmer location. D. Discuss with the client impulse control problems. A client diagnosed with bipolar disorder is distraught over insomnia experienced over the last 3 nights and a 12-pound weight loss over the past 2 weeks. Which should be this client's priority nursing diagnosis? 1. Knowledge deficit RT bipolar disorder AEB concern about symptoms. Altered nutrition. Less than body requirements RT hyperactivity AEB weight loss. Risk for suicide RT powerlessness AEB insomnia and anorexia. Altered sleep patterns RT mania AEB insomnia for the past 3 nights. A client diagnosed with bipolar disorder, depressive episode intentionally overdoses on sertraline, Zoloft. Family members report that the client has experienced anorexia, insomnia, and recent job loss. Which nursing diagnosis should a nurse prioritize? 1. Risk for suicide RT hopelessness. A client diagnosed with bipolar I disorder, manic episode refuses to take lithium carbonate, Livabid, because of excessive weight gain. In order to increase adherence, which medication should a nurse anticipate that a physician may prescribe? 2. Valproic acid, Depakote. Valproate is a mood stabilizer medication that works in the brain. It is approved for the treatment of mania associated with bipolar disorder, also known as manic depression, seizures, epilepsy, and migraine headaches. Bipolar disorder involves episodes of depression and/or mania. A client diagnosed with bipolar I disorder is exhibiting severe manic behaviors. A physician prescribes lithium carbonate, Escalif, and olanzapine, Zyprexa. The client's spouse questions the Zyprexa order. Which is the appropriate nursing response? Zyprexa in combination with Escalif cures manic symptoms. Zyprexa prevents extrapyramidal side effects. 4. Zyprexa calms hyperactivity until the Escalif takes effect. A client began taking lithium carbonate, Livabid, for the treatment of bipolar disorder approximately 1 month ago. The client asks if it is normal to have gained 12 pounds in this time frame. Which is the appropriate nursing response? 3. Weight gain is a common, but troubling, side effect. A client diagnosed with bipolar disorder has been taking lithium carbonate, Livabid, for 1 year. The client presents in an emergency department with a temperature of 101 F, 38 C, severe diarrhea, blurred vision, and tinnitus. How should the nurse interpret these symptoms? 4. Symptoms indicate lithium carbonate toxicity. What tool should the nurse use to differentiate occasional spontaneous behaviors of children from behaviors associated with bipolar disorder? 2. Find tool. The nurse should use the Find tool to differentiate occasional spontaneous behaviors of children from behaviors associated with bipolar disorder. Find is an acronym that stands for frequency, intensity, number, and duration and is used to assess behaviors in children. A nursing instructor is discussing various challenges in the treatment of clients diagnosed with bipolar disorder. Which student statement demonstrates an understanding of the most critical challenge in the care of these clients? 4. Treatment is compromised when clients choose not to take their medications. A client is diagnosed with bipolar disorder, manic episode. Which nursing intervention would be implemented to achieve the outcome of client will gain 2 pounds by the end of the week? 1. Provide client with high-calorie finger foods throughout the day. A nursing instructor is teaching about bipolar disorders. Which statement differentiates the DSM-5 diagnostic criteria of a manic episode from a hypomanic episode? 3. During the manic episode, clients may experience psychosis, and this symptom is absent in hypomania. A client has been diagnosed with major depressive episode. After treatment with fluoxetine, Prozac, the client exhibits pressured speech and flight of ideas. Based on this symptom change, which physician action would the nurse anticipate? 2. Discontinue the fluoxetine and rethink the client's diagnosis. Which is the basic premise of a recovery model used to treat clients diagnosed with bipolar disorder. 2. Empowerment of the consumer.